Good afternoon, my name is Joshua Sterriker. I'm one of the fourth year medical students from Brighton Sussex Medical School, and I'm going to be showing you how to make the ADAMgel emergency front of neck access airway mannequins. There's two parts to these mannequins. You have the reload, as I've come to call it, which is this housing here, which is what you're going to be performing the techniques through. And then there's the holder, which is this unit here, which is designed just to add some stability to the model and also to add the sort of anatomical differences of the patient in terms of having that difficulty with accessing the neck with the head in the way. We're not going to be talking much about how to make the holder in this video. There'll be a separate video for that another time, but for now we're going to concentrate purely on the reloads, as these can be used independently of the holder. Now, to make the reloads, there's a few things you'll need. The first one is a Tupperware. So this is a 0.4 litre plastic Tupperware housing. You'll also need some anaesthetic airway tubing. So this is the standard anaesthetic circle circuit tubing, not the coaxial stuff. You'll need some form of artificial larynx. Now these can be made in quite a few different ways. These ones have been cast, so someone cast this a long time ago, let me borrow it, and then I made some adjustments to include a full cricoid ring, which means we don't need to use the cable ties, and I've recast a new one. Alternatively, you can 3D print these, and the documents for that are freely available on Thingiverse. And the other option is to mould them by hand out of silicone sealant, and there's another video online that I'll link in the description of this one where you can see that being done. The next component will be some ADAMgel for padding the model. We're not going to be going through the process of making the ADAMgel in this video. There's a couple of very good videos that are already available showing you how to manufacture the gel and how to recycle it once it's been used. You'll need some form of cricothyroid membrane, so we've been using microfoam tape with some value band stretch band backing and covering the adhesive. You'll then need your ADAMgel soft tissue surrogate that will be performing the techniques through. And then on top of that, you'll need 2 layers of stretch band. The colour doesn't really matter, but the different colours are different thicknesses. So if you wanted to change the thickness of the skin on your model, then you could choose a heavier grade of stretch band. You want one small layer that's going to go underneath, and then a top layer that will cover the surface of the entire model, and then when the lid's clamped down on top of that, it will hold everything in place nicely. The first thing to do is to prepare the Tupperware box, and there'll be a 3-minute video now that will show you the process of doing this.
So when preparing the lids for the models, we want to cut out the demarked area in the top of the lid. The best way that we found to do this is using a diamond cutting disc or a Dremel. Obviously if you're going to use this method, please be very careful. As you can see, shards of plastic can get thrown, so wearing eye protection is very important. And they're also quite loud, so please wear some ear protection as well. Dremels are obviously quite sharp. The blade's going to be spinning around about 15,000 RPM, so you want to be make sure you're in full control of the Dremel at all times and try and do what you can to make things safer for you. If you need to secure the Tupperware box down before doing this, please do so. Alternatively, you can use the method that I'm doing here with great care, and that's using the Dremel in the right hand and pulling the Tupperware away with the left. Now the Dremel's operating in clockwise direction, so theoretically if it does bite, it should hopefully jump away from you rather than towards you, but there's no guarantee of that, so please be careful. Now once you finish cutting out that area, you're going to want to pop the piece that you've cut out away. It's generally just held in at the 4 corners where the Dremel doesn't quite get to. And then once that's been done, you need to start sanding away and preparing the edges so they're not so rough and sharp. There's a few options for this. The best option would be to use the drum sanding attachment for the Dremel that you can see here. It's the quickest and easiest way of doing it, and it'll give you a very good result. Alternatively, you could use a hand file to go through this. It'll take a little bit longer, a little bit more work intensive, but it will get the job done and doesn't cost as much as the Dremel. And alternatively, you can use just a bit of sandpaper. But once the lid's been prepared, it's time to make the hole in the side of the Tupperware. Now the best option we found for doing this is to use a 28mm hole cutting bit. So obviously this can slip and it is sharp, so please be very careful. It's quite difficult to to get the drill started. It shouldn't take much pressure and doesn't take very long, and as soon as it has bit, it will go through very quickly and easily. And all that's left to do once that's done is to slightly enlarge the hole so that it can accommodate the anaesthetic airway tubing. Again, using the drum sanding attachment is the best option. It'll enlarge the hole whilst sanding the edges far cleaner, ready to use. And there we go. That's cut out, the lid's prepared, the box is prepared, so now we're ready to start putting the model together.
So once you've done that and you've got a prepared Tupperware with a nice big window in the top and a sensible hole in the front for the tubing to fit through, we'll take the airway tubing and we'll take our artificial larynx and put them together. And then once you've done that, you'll want to cut out the window here. Otherwise, when you first perform this technique, you'll cut a small hole in the plastic, you'll insert your ET tube, and then you'll either rip the cuff on the way in or rip it on the way out, and then you'll have to replace the ET tube every time you're practicing, which is far from ideal. Once that's ready, pop the tubing through the hole in the plastic and seat the larynx. When you're seating it, you want the larynx to be off center, or the hole to be off center. That's quite important for recycling and getting the most out of the models when you're using them. We'll discuss that further later. Once that's done, we'll take some of our padding and we'll pad the sides of the model. That way it helps stabilise everything inside and stops it all from flopping around so much. We'll then take our cricothyroid membrane and we'll place that over the top. And ideally, if you place one corner over the top of the window, you can then rotate this after each use, and you can get about 5 uses out of one membrane, which again makes it a little bit more economical. We'll take our soft tissue layer and we'll place that over the top, and then taking our smaller sub-layer piece of skin, artificial skin, we'll pop that on top of the gel and we'll just fold the edges in there. We'll just tuck them in a bit, as otherwise if you have too many things on the outside of the model, it prevents the lid from closing sometimes. Place the larger piece on top. Oops. And then clamp it all down. And that's set up ready to go for the palpable membrane, which will be for the stab, twist, bougie tube technique, which you'll see later. Now, for the fat neck setup, it's pretty much the same. You have your padded layers here, you've got your cricothyroid window, there's your membrane over the top, taking a slightly thicker piece of ADAMgel over the top of the membrane, followed by your standard soft tissue skin layer, sub-tissue layer, sorry, with your sub-layer of skin, then your top layer, and then we pin all that down again with the lid. There we go. That's much thicker, no palpable landmarks at all, and ready to go. So when it comes to airway management, there is a set of guidance on the Difficult Airway Society for managing a difficult airway. They start off with simple measures such as your bag valve mask ventilation with the head tilt, chin lift or jaw thrust, moving on to the use of basic airway adjuncts, to eye gels, to intubation. And should all that fail, and there's a number of attempts you're allowed, and I'll put the guidance in the description, you would then be moving on to your emergency front of neck access, your plan D. To do that, if you're in an anaesthetic setting, the only additional piece of equipment you should need is a size 10 blade. The rest of the stuff should already be on your airway trolley. If you're in another environment, the piece of equipment you'll need are your size 10 blade, a bougie, and a 6mm ET tube. And the reason we use the 6mm ET tube and a 10 blade is because the size of the 10 blade pretty much matches quite nicely the outer diameter of the 6mm ET tube, which means there's no need to dilate your incision or extend your incision through the cricothyroid membrane once you've made it. Now, when you have a patient who has a palpable cricothyroid membrane, you're going to be using the stab, twist, bougie tube technique. So it's very simple, very quick and effective. The only things to be aware of are a little bit of patient anatomy. So Either side of your cricothyroid window run your anterior thyroid arteries, which is one of the reasons why we do a straight stab incision. We don't extend it laterally at all, because you're going to go through one of those vessels. Part of the technique involves doing a caudal twist of the blade, so the blade is then facing down the patient. There's a few reasons for this. One of them is the cricothyroid artery runs at a superior aspect of the window, so if you're turning your blade the other direction, you do risk damaging that vessel as well, so having it face down protects that vessel. The second reason is when your blade is in position and you've twisted it, you're going to run your bougie through as a guide, and you're going to be running the bougie against the blade. If your blade is facing up, there have been instances in training where we've noticed that bits of the bougie have been shaved off by the blade and have ended up in the patient's trachea. Not ideal. The third reason, once the blade's in place and your bougie's seated properly, your hand is going to be right next to the blade, and as you withdraw the blade, if the blade is facing up, you risk cutting your finger. If it's facing down, it's much safer. If you touch the blade at all, you're going to be touching the back of the blade, which is blunt. And again, in training, we have seen people do this the other way around and catch their thumb on the way out. So this will be a slow demonstration of the stab twist bougie tube technique in a patient who has a palpable cricothyroid membrane. You'll need your size 10 blade, your 6mm ET tube, something to inflate the cuff, a bougie, and then something to ventilate the patient with afterwards. First thing to do is ensure you position yourself correctly. So I'm right-handed, so I'll be standing to the left of the patient. This is because when I'm inserting the bougie in the tube, I'm going to be using my right hand, so that's more ergonomic for me to place the bougie in the right direction. If you're left-handed, it's the opposite. The next thing I'm going to do is use my middle finger and thumb to stabilise the neck, use my index finger to palpate. I'm going to start by locating the thyroid cartilage, which is at the top, thyroid notch. I'm going to work my way down until I feel the dip where the cricothyroid membrane is, confirm my position by feeling the cricoid ring underneath, and then when I've landmarked the cricothyroid membrane, I'll move my finger back very slightly, and with a straight stab incision, only inserting as far as roughly where the guard on the BP handle is, where the attachment is, so only about sort of 8mm in. I do a straight transverse stab. There's no movement either side, it's straight perpendicular to the patient. A caudal twist, so the blade is now facing down towards the feet. And I'm going to swap hands at this point and pull some lateral traction towards me, which will open up the space for the bougie. When you're pulling the lateral traction, you want to keep the blade perpendicular. Again, if you angle the blade, you risk hitting the side wall. If you insert too far, you risk going through the posterior wall of the trachea. And at the same time, your blade is going to be your guide. So if you've bent the blade to the side, it's going to make it far more difficult to insert the bougie correctly. So the blade is perpendicular, we're pulling lateral traction, tip of the bougie in and rotated around and pushed down into the trachea, only about 10 centimeters. The blade is then removed, and again, blade facing down so it's safe to remove. I'm not going to cut myself. I'm going to let go of the bougie at this stage because I'm on my own, but ideally you wouldn't let go and someone else would railroad the tube for you. Place the tube over the top, someone else is now holding the bougie, and then with a slight twisting motion, going to advance through until the black line on the ET tube has just passed the skin. So the same mark you would use for landmarking the tube position against the vocal cords we use for the skin in the thin patient. So that's now in place. The bougie can be removed, and then we shall inflate the cuff. Again, not letting go of the tube at any time, and then we can ventilate the patient. So once the insert's been used once, it needs to be replaced and reset for the next person to use. If you remove the bag, remove the insert, place a new insert in, replace the bag, that's now ready to go for your next candidate. When they're doing that, you're going to be wanting to, or have someone to replace this or reset it for you. Now, if you remember earlier, we said about having the larynx off center. Now, this has been left on center to show you that you cannot now rotate this to reuse it because the hole is in the same place. However, if the window was off center, further down, we could have then rotated this piece of gel with the artificial skin on it and had a second use rather than having to reset all of it completely. However, if you have had it offset correctly, the first thing to do is to rotate your crocodile membrane. As you can see, we've used it once on this corner here, so we'll rotate it around 90 degrees and replace it. We've rotated our gel, so there's now no hole over the top of the window, and we'll rotate our artificial skin as well, so it's no longer over that window. Now obviously when you reset the model after it's been used once, there will be a hole here. However, hopefully candidates won't just think that that is where the membrane is and attempt to do the technique through that, because they'll just hit the thyroid cartilage. So it still doesn't prevent them from doing the technique properly, and they should still be landmarking the correct anatomical landmarks before doing the technique. So now the model's been reset, we're going to do a demonstration of the stab twist bougie tube technique in real time without pausing. So I'm on the right hand side of my patient, sorry, the left hand side of my patient because I'm right handed. I'm feeling for the thyroid notch, which is here. I'm working my way down to the crocothyroid membrane, transverse stab, caudal twist, swap hands and pull lateral traction, bougie in, blade away, railroad the tube over the top, bit of twisting through to the black line, bougie out, cuss up, and then attach the ambu bag, ventilate your patient. So now this model's been used twice, we need to reset it completely. So the first thing to do is to reset our crocothyroid membrane, because we can get a third and fourth and fifth use out of this. We're going to get rid of our gel, so we'll take the skin, the artificial skin off that. We'll get rid of this piece of gel that can't be used for any further ones for now, so we'll put that to one side for recycling. This piece of sublayer has been stabbed through twice, so we're going to just peel that in half, and then that can be used to make some more crocothyroid membranes. We'll then take the top layer of skin here. Now this has had two piercings, so what we can do is split it down the middle, and then we can use both of these as sub-layers for future techniques. We can take our layer of gel, fresh layer of gel over the top, put a piece of stretch band skin, or sub-layer of skin, over the top of that, and then we can take a completely new piece of stretch band, place it over the top, clamp it all down, and that's now ready to go again for another simple case. So this will now be a demonstration of the vertical cut down technique for the non-palpable crocothyroid membrane. So this could be a burnt patient or an obese patient. In this case it's going to be an obese patient where we can't feel the membranes. So we're going to try to feel for landmarks and we can't feel a thing, not even the thyroid notch. So we need the same equipment as before, your 10 blade, your 6mm tube, your bougie, a syringe and a bag to ventilate the patient with. I'm still on the left hand side of the patient because I'm right handed. The first thing to do, recheck that I can't feel any landmarks, which I can't. So I'm going to do a 10cm chordocephalad incision, going only through the skin and the first sort of millimetre or so of subcutaneous skin, subcutaneous fat, sorry, using the belly of the blade, not the tip of the blade. This is where the patient's head comes in and causes some issues with the technique, but that's something you need to work around. So we stabilise the neck and the skin, belly of the blade, 10cm incision, starting at the jugular notch, working your way up. Once you've done that incision, you're going to then blunt dissect down with your fingers until you can palpate the crocothyroid membrane, and then we revert to the previous technique: stab, twist, swap hands, bougie, guided by the tube, guided by the blade, blade away, and then we railroad the tube over the top, bit of twisting until the tube's in place, bougie out, then we inflate the cuff, and ventilate the patient. Now once we've done the vertical incision technique, we can't reuse this at all, we can't use it a second time, so we reset it completely. So first thing again, the top layer of skin can be peeled in half to be used as two sub layers. for later techniques. The sublayer of skin that's been cut through can be put to one side to be backed with microfoam tape to create more cricothyroid membranes. We'll take our artificial tissue layers away and we'll rip this one in half. Now the reason I say that is because we can then, if we run out of some of the thicker gel that we have for padding the for padding the neck, like this stuff, we can use 1 or 2 layers of this underneath the main layer of gel to act as our padding to prevent you from being able to palpate the membranes. So we've rotated our cricothyroid membrane. We're going to take a piece of the gel used from the last case that we cut in half. We'll then put another piece of gel, the main piece of gel, over the top. Put our sub-layer of stretch band skin on. Then cover it all with a new piece of stretch band. And then clamp it down. And that's now, again, nice and thick. You can't palpate any of the landmarks and it's ready to go again. So the last thing to mention is the third option for setting this up, which is for burns patients. Now, the best way we found for doing this is to start exactly the same as you have done with your padding, your artificial larynx and your tube. And you're going to use then a piece of chamois leather that's just been cut up. So this is used chamois leather. Place that as your new cricothyroid membrane. This is far tougher and more difficult to cut through. You're then going to place your slightly thicker layer of ADAMgel. Obviously burns the patient's neck's going to swell slightly, so in a thin neck patient we're going to put a slightly more padded piece of gel there, and then we've got some pieces of leather. So I think this might have been an old handbag, an old leather handbag of some sort that was used, but we've cut that up into pieces. That then goes over the top, and that then is used to simulate sort of more thick leathery skin. Now if you find like this one, it's still slightly loose in there and things are moving around, you can place a piece of the stretch band skin over the top of that. So obviously the purpose of this is that the skin layer on the top is far tougher and more difficult to cut through. So that stabilizes things still, but you still have that much more rigid skin and you won't be able to feel any membranes again. So you will have to, you won't be able to feel any structures, so you will have to go revert back to the vertical incision technique, which means that you have to cut through that piece of leather. So it's far more difficult to do and it's a good third option. So with regards to running courses or training days using these models, we found that it's best to have 1 model per candidate per station. So if you have 4 candidates in one station doing both the thin neck and the fat neck, it's best to have 4 thin neck reloads ready to go and 4 fat neck reloads ready to go. That way, as soon as one of them has practiced the technique, you're swapping it for a fresh one while you have someone else who is swapping and resetting the models. Because they are slightly more complicated than some of the other commercially available models like the VBM Crico Trainer, which is effectively a piece of foam that you slide across. It takes a little bit longer to reset them, therefore we found that from an efficiency point of view, having a dedicated person to fulfill that function speed things up and makes things a lot more smoother when running, especially fast turnover training days. And once you finish your training day or your practice session, you're going to have some things to dispose of or to reuse and reset. So the first thing to talk about is your gel itself. Don't throw this away, it is reusable. None of the gel that we've ever made has had to be thrown away, it's all been reused and recycled. There's a video explaining the process of doing this in more detail, but ultimately it comes down to chucking this stuff in a blender, blending it into very small particles, putting it in a microwave with a little bit more water and antifreeze and anti-foam, melting it back down, casting it back out, cutting it to shape and reusing it. And we've done that dozens and dozens of times with the gel that we're using here today. We haven't had any problems with it. With regards to the cricothyroid membranes, once you've done sort of 5 techniques through this, or if someone's been a little bit liberal with the blade and has gone straight through it on their starting technique, and you need to replace it, the only thing you can do with this, unfortunately, at the moment is bin it. We haven't found a good way of recycling these. We are looking into alternative options for the cricothyroid membrane that would be more recyclable or something that can be repaired and reused, but at the moment this is the best thing we've found. With regards to the stretch band, you are going to end up with an abundance of this, I'm afraid. But once you have used this twice, so you've used it once or twice for the stab twist bougie tube technique or for the vertical incision, you've cut it in half, you've used it as a sub layer, it's been stabbed through again, you can then back it with microfoam tape, and then you can cut that into several more cricothyde membranes. And then once the cricothyde membranes have been gone, then it will get disposed of. So you'll end up with quite a bit of extra of this, end up with quite a lot of these. But as I say, it's a process at the moment where we're trying to make things more efficient and economical, and as things develop and change, things will get better. So thanks for watching and for listening. If you're interested in having a go with these models, learning a bit more about how they're made or recycled or used, or the efficiency of using them in courses or the benefits of using them, please by all means get in contact. Currently, these have been used at DAS 2022, they've been used at the Queen's Airway course in Romford, they've been used in Brighton, Worthing, Chichester, and there's even models in Uganda and Ukraine teaching the frontline soldiers in Ukraine how to do this technique as well. So they are really good, they look a little bit more complicated than the rest, and they are, but they are incredibly beneficial. The muscle memory you'll gain from using these models over using some of the other commercially available models is far superior, but at the end of the day, there's no substitute for practice, and learning this techniques once is not good enough. You will need to do regular training to maintain your skills. Thank you.